All right, good. So now, having understood that, let's see. Um, um, we also talked about another muscle that is enclosed in a sheath called the rectus sheath, right in the middle. When men or boys go gym, you see that, line, or they call it abs. Okay, it's the rectus sheath. The muscle inside the rectus sheath is the rectus abdominis muscle. The rectus abdominis muscle looks like this. So this is the abdomen. I'm gonna draw it, and so the rectus sheath is like this, and then this is the linea alba, and then you have parts, the one they call six parts, right? So it looks like this. So right here you have the rectus sheath in the middle. That's the rectus sheath. This is the linea alba, all right? And these are the six parts. These lines here that form these parts are tendons that is holding this muscle. So the muscle in the rectus sheath, inside this sheath, is described as the rectus abdominis muscle. Inside the rectus sheath, you have other structures. You have other things like blood vessels. Important blood vessels in the rectus sheath are the epigastric vessels. The superior epigastric vessel, which is a branch of the internal mammary artery. The internal mammary artery is a branch of your subclavius, the subclavius artery, both right and left subclavius artery, and the subclavius artery is a branch of the brachiocephalic trunk if it is from the right side, and if it is from the left side, it's directly from the arch of aorta. And the inferior epigastric artery is a branch of the external iliac artery. So they drive inside the rectus sheath. So if you're a surgeon and you're cutting through the rectus sheath, you have to be careful not to cut the epigastric vessels. So the epigastric vessels are either artery or vein. So other structures that are found here is another muscle that is absent in 20% of people. That muscle is a small pyramid muscle. It's a small pyramid muscle that is somewhere here. The small part is called pyramidalis muscle. It is found in the rectus sheath. It is absent in 20% of people, of the population. Okay, we also have lymphatic vessels in this. We all have lymphatic vessels. We also have lymphatic nodes, and some important nerves are found in the rectus sheath. All right. Now, like I said before, if this is my abdomen, the anterior abdominal wall, and superficially in front, and then when I flip it all around here, I'm seeing the inside cover. And this is the inside or the internal aspect of the anterior abdominal wall. The internal aspect of the anterior abdominal wall is thrown into ligaments and fossa. It is thrown into ligament and fossa, just like this. This is the inside cover. So the midline ligament or the midline fold is called the median, median, median umbilical fold. The median umbilical fold continues from the apex of the bladder. That's the bladder you're seeing, and that's urethra. Okay, that's the bladder. So it continues all the way upward and begins to go through, joins with the umbilicus, that's the umbilicus, and then goes all the way upward and joins with the falciform ligament that attaches the lever, that's the lever, to the anterior abdominal wall, and then eventually becomes a round ligament right on top of that. Now you see here, embryologically, the median umbilical fold is a remnant of the umbilical vein. Remember the umbilical vein that transports oxygenated blood from the placenta to the baby, all right? So that is the remnant of the umbilical vein. So it becomes the median umbilical fold. So the median umbilical fold covers the median umbilical ligament. Now lateral to that, lateral to the median umbilical fold, is the medial umbilical fold. The medial umbilical fold are two. So we have one here, we have the other one here. So there's a right here and there's a left here. Okay? The right and left median umbilical fold encloses the medial umbilical ligament. The medial umbilical ligament, a remnant of the umbilical arteries. Remember that the umbilical arteries brings deoxygenated blood to the placenta, so they regress, and now that is what you have there. And then you have the lateral umbilical fold. The lateral umbilical fold actually covers the inferior epigastric artery, so it covers the inferior epigastric artery. Okay, now we have fossa. So we have the supravesical fossa. The supravesical fossa is just right here on top of the, you see that? All right, that's the supravesical, meaning the bladder, supra on top. So that's a fold. A fossa, that's a fossa. And then we have the inguinal fossa here. So we have the medial inguinal fossa. All right, the medial inguinal fossa. The medial inguinal fossa has a triangle there. That's the Hasselbalch triangle. The Hasselbalch triangle. You can see that, right? That's the Hasselbalch triangle. So the Hasselbalch triangle has boundaries. The boundaries of the Hasselbalch triangle are, I'm going to stop here because